When you have gone through breast cancer treatment, your mind, unsurprisingly, may be all over the place. You have stresses, mental challenges, and various different thoughts in your head that may be preventing you from recovering from your treatment and moving on with your life. Today, I'm going to talk about some possible thoughts you may be having and what you can do to fix them. I don't want to return to my normal socializing because everyone will be talking about me and it will be awkward. A breast cancer diagnosis is life-changing. The treatment can be challenging, and when you get through to the other side, not only is it a relief, but you may just want to reflect on the whole process and give yourself the time and space to think. And so the last thing you may want to do is to talk about the whole process again with your friends and family. This may have meant that you may have shielded away from socializing since you have finished your breast cancer treatment. And I completely understand. You may not be ready to get back to your normal socializing group, as you may feel that the conversations may be awkward and that they may ask you difficult questions. Although you may think that socializing is going to be a real effort and a challenge, there are also so many breast cancer survivors out there all around the world who have returned back to their normal lives, re-engaging in social activities. They took the plunge and they went for it. I know many who were hesitant to do this for the longest time. Thing is, the longer you wait, the more difficult it will become. The benefits of reconnecting outweighs the fears of what you may think the challenges may be. By reconnecting with your social circle, you'll gain support, connections, and joy and normality. And it may not be difficult as you think. An easy thing to do would just ping a text to a friend you haven't connected for a while and open up the channels of communication. Your friends may have wanted to do the same but were scared and afraid themselves. So take action. You may be surprised by the results. If I exercise, it can cause damage to my surgical site and aggravate the disease. Obviously, after surgery, there will be a certain period where you would have been advised not to do certain exercises. But once you have been given the go-ahead by your surgeon, you may still be wondering whether doing exercise may cause either damage to the surgical site or somehow cause more tiredness and more fatigue, and generally make you feel more rubbish than you may already be feeling. And this may be true especially if you have just finished chemotherapy or radiotherapy. The thing is, exercise after breast cancer treatment is probably the best thing you can do. Once you have been given the all clear from a surgeon, there is no reason why you can't do exercise. I know so many of my patients who exercise, even through their chemotherapy treatment. I had a patient once who would go to her Zumba classes while she was going through chemotherapy, and this was the thing she looked forward to the most. After the class, she felt invigorated and full of energy. Exercise does not aggravate the disease. In fact, it does the opposite. We know that in breast cancer patients, exercise has been shown to reduce the rate of recurrence and increases survival. Not only that, the benefits of exercise goes beyond the benefit to physical health. It also benefits your mental and emotional health too. Now, if you don't normally exercise and you don't know where to start, you don't have to overcomplicate things. Just start by walking anywhere, whether that's around where you live, in the park, to the shops, it doesn't matter. Just get moving. Then you can build up your cardiovascular fitness by walking further and farther, and you may even consider jogging. You can then join a gym, you can do couch to 5K, or you can exercise for free by following the thousands of free exercises you can watch on YouTube. And also don't forget to incorporate weight and resistance exercise eventually. And you can check out a video all about the importance of weight and resistance training that I've made, and I'll leave the link below. On the other hand, if you already have a level of fitness, then definitely there's no reason why you can't return back to that level or even surpass it. Of course, you may need some modification depending on your surgery, but getting back to your normal fitness routine is probably the best thing you can do. Gaining more knowledge about breast cancer will cause me more stress and anxiety. And this is a thought many people might be thinking about. Yes, there's so much information about breast cancer out there. When you are diagnosed, all of a sudden you are bombarded by scientific terms and words you previously would not have even heard of. grades, stage, ductal, lobular, invasive, metastatic. The list goes on. The thing is, we know that little knowledge can in fact be a dangerous thing. If you're only aware of the top headlines, snippets of information from Google can confuse you even more. And the thing is, you don't even know whether the information out there can be trusted or even whether it's correct or accurate. You probably also know friends or family members who have had breast cancer too, and you may have talked to them about their diagnosis and treatment, and you have received a lot of information and advice. The potential problem with this, though, is that people's breast cancers can be totally different to the other person and the next. And so comparing your breast cancer to someone else's and getting all the information about their treatments may be completely different to what you may need or have been recommended, which again can lead to more confusion and worry. I know so many people in my community who have said that gaining knowledge about their breast cancer diagnosis have helped them tremendously. Not only in understanding the disease process, but also in learning how to identify possible worrying signs and symptoms, to learning how to examine your breast and chest wall the correct way. The other important thing is to know, not only more about the cancer itself, but also it's important to learn about how to manage the emotional impact of the diagnosis. The things you need to do to be able to move forward with your life after breast cancer. And so if you think this is something you want to learn more about, I've actually have got a course in the pipeline to empower breast cancer patients and survivors to thrive and live their best life. And you can go to the comment section and you can join that wait list by clicking the link. I hope this has been helpful. I'll see you in the next video.